Your Neighborhood, brought to you in part by the Clemo. Choose the Clemo and start living your life your way.
Bellefleur Physiotherapy in Orléans. Hello. Good morning to you, Jason. I'm yelling a little bit. You've got a patient here. What do you have going on here?
So we are a physiotherapy clinic that we help people with any sort of ailments, limitations, things that have an impact on their day-to-day life. So today we have a patient here who's having some knee issues, okay? So I would quickly check to see, how she's moving. See, I feel a little bit of a block there.
Okay.
So I'm going to do a bit of manual therapy. So we're a very hands-on clinic. So we do a lot of this kind of manual therapy stuff.
Yeah.
Just a few more here, and then let's go. See, right there, it's already a little bit better.
A little bit more,
less
right?
resistance to the movement.
Aha, that's what you're looking at.
So we're looking at helping people move better, which then we have a great spot for them to go and exercise and strengthen next door at our fitness studio.
Oh, we'll take a look then.
Yeah.
So Jason, we just go from physiotherapy
Yes.
now to fitness. This is a fitness center here.
Yeah, so we started this because we didn't know where to send our people that they could work out after their physio
Yeah.
in like a safe environment. And a lot of them had apprehension about going to a big gym.
So when they get treatment,
Yeah.
they get physiotherapy, for example, for maybe arthritis, let's just say,
Sure.
and then you prescribe some repetitious work that can strengthen the ligaments, then they're off on their way normally.
Right.
But now they can just come around the corner and come here.
Right, so we created this so that they get assessed by a personal trainer.
Okay.
And then the personal trainer develops an exercise plan just for them that they can kind of go through in consultation with the physiotherapist.
It's right there.
Yeah.
Right next door.
And then they come in for their hour workout. Personal trainer's there to guide them, make sure they're doing everything correctly.
There's always somebody here
All
on
the time.
hand.
Yes.
Okay, this
Certified personal trainers working with the clients.
And I noticed, I saw them working on tablets, the clients, so they get to...
Everyone's exercise plan is on the tablet. And
so you don't
everyone's-
forget,
yeah.
it's right there.
Right.
Okay, so for example,
Yes.
you're working on a client,
issue, yeah.
a knee issue. So what would you do with a follow-up after they go through physiotherapy? What's a follow-up on the fitness side that can help?
So they'd be assessed by the trainer, but then the trainer, because of being in a physiotherapy clinic, they're used to kind of modifying and adapting the exercises.
Okay.
So I'm thinking of a common one being a squat, which is a super functional movement.
Okay.
So squats sometimes, depending, and I'll have Elise here show
Elise
us.
is back.
So,
Here we go.
So just do a regular kind of squat for me, like don't, okay. You feel that in the knee a little bit, the hips? Yeah.
Yes.
So we can do one modification that's usually something that people with hip or knee arthritis really are surprised at. They can actually do a squat. So we're going to just widen our base of support a little bit, and then we're going to turn our feet just slightly outward.
Okay.
So that opens up the hips.
Yep.
And then we go and squat, and we have an easier time getting really low.
Opened up, right.
And so because the hips are moving more, there's less strain on the knees. So it's an easy movement to do.
It's amazing what you can do with just your body weight.
Right,
Yeah.
and just, some small little modifications can make a world of difference for people. And that's what we're all about here, is modifying things so that they can work out and stay active.
And you monitor, you follow
Oh, absolutely.
up. It's incredible. I see you can work with your own body weight, but then you've got
We've got a
weights
lot of equipment,
here.
a lot of equipment.
Great equipment.
Smith machine, all sorts of stuff.
Yeah.
And the nice thing is, the trainers have a question. They just come knocking at our door. Hey, I have a question for so-and-so. Can we make modifications?
This is a wonderful center here. I mean, Orléans is lucky to have you. I think that Elise, myself, and you, Jason, we should go back, finish up here with that great move with the squats. Turning the feet out just slightly. Is that it?
Yeah, just
okay.
like,
Open up.
Go a little bit wider.
Okay, there we go.
There
A
we
little
go.
bit wider.
And there we go.
Oh, that feels so good.
Yeah.
Yeah.
Excellent. Good
That's
job.
good. I'm going to keep going. Thank you so much.